Being involved in social care and being a parent carer of someone who receives care, I'm very passionate about making sure that people live their best lives in the sector. And how do we do that? Well, we make sure that we're on a journey together, that we try and have staff that don't keep moving around, that you have a team around the person you support, that sometimes when they come into your service, they're full of mistrust, and how we can turn that around. And I've had children as young as 12, 13 who've come into our service really had been neglected and lots of trauma, and then a few months later we've been able to stabilise them and get them in a much better place. It doesn't mean it's easy every day. It's the same with learning disabilities and challenging behaviour. There's nothing that fulfills me more than actually seeing those behaviours reduce. And I think from a commissioning and social work perspective, you don't want to be hanging on to large ratios of staff if you don't need it. I mean, one thing with this kind of work is to try and reduce staff so you don't have 5, 4 or 3 people working with an individual. Sometimes it's needed. Sometimes you might have a period of instability that takes you back there. But what I'm not interested in is warehousing people in the long term, but actually how we can see that journey to wellness. And I can think of an example of someone we supported who started at 5-1 and ended up moving into her local area in a bungalow, adapted, with quite considerable learning disabilities and mental health conditions, but we were able to get her out and about in the community 1-1. That doesn't mean it's overnight, but those are the success stories. That is why I do what I do.